spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, good morning. Thanks for tuning in. It is 10:30 here in Hawaii, which means it's time for Spotlight Hawaii. I'm Ryan Kalei Suji, joined by Yunji Denise. And today we continue on in our conversations on the topic of COVID-19, its impact here in our community, focusing today on an area that we know we usually get a lot of questions in our comment section on.
That's right. We are talking about COVID and kids, and we are so lucky this morning to be joined by Dr. Douglas Kwock of Hawaii Pacific Health. He's a pediatric infectious disease specialist, also a general pediatrician. We are so happy to have you. Thank you so much for being with us, Doctor.
Hi, Yunji. Hi, Ryan. Thank you for having me.
So today, the State Department of Health, Hawaii Department of Health, is reporting 11 new coronavirus-related deaths, 493 confirmed and probable infections in the state. We've been told that about 20% of those new infections, when we see those numbers, we can assume are kids. What are you seeing in the hospital when it comes to COVID and kids? Those, hundreds of kids now every day that are getting infected with the virus.
Yeah, well, those kids are 12 and under, don't have access to a vaccine yet, so they remain an unprotected population. So, it's not surprising that we are seeing cases in that age population. And for the most part, the kids do better than adults do with the COVID infection. So, less requirement for hospitalization, but nonetheless, kids can get infected and they can get severe infections. So, we do end up having children admitted to the hospital for treatment.
And when they are brought in for treatment, I imagine that if they're coming to the hospital, obviously there is some level of urgency and, care that is needed. Can you talk us through what are some of the things that you're seeing in kids specifically, if it's any different from those and what you're seeing from adults?
What's different than adults is that, the kids thankfully tend to be infected less severely than adults. But, when they do get infected severely, their treatment remains pretty much the same, depending on the severity of their illness. They might come in and require maybe just a little bit of oxygen support, but some of them do end up getting put on a ventilator to help with breathing. And everything in between. We do have medications that we can use to treat children. It's the same medications we use in adults. So for the most part, the children would get the same treatment depending on how severe their infection is.
A year or so ago, before the Delta variant, when we were talking about infections, there was this perception that kids were sort of, I don't want to say immune, but much less likely to get severely ill. And really our focus was on the elderly. Now that we have Delta as part of the mix and we know that pediatric infections are up, where are we seeing the biggest growth? Is it young children when I think of someone, let's say, under the age of 12 who has no access to the vaccine? Or is it more in the sort of teen and preteen set?
I would say the biggest growth is in the area of unvaccinated individuals, whatever age bracket that is. Depending on the uptake of the vaccine, that's where we're seeing more of the infections and the new cases popping up. And so, because the vaccine is not available for 12 and under, it is a population that remains unaffected or unprotected. But, we do see infection in elderly individuals or young teenagers or young adults that haven't gotten vaccinated yet. So in general, it's more the unvaccinated population.
Overall, I know that we are concentrating this show on kids, but if you can give us a glimpse of what the overall health system at Hawaii Pacific Health is dealing with right now as we continue to monitor hospitalizations. Of course, HPH represents four of the largest hospitals within our state, but if you can give us an update on how things are looking there at Hawaii Pacific Health.
We're doing okay at Hawaii Pacific Health. There are periods of time when we're strained. It really depends on a day in, day out basis on how many hospitalizations we get, but we're not by any means overrun, and together as a community with support from all the other facilities working together, we are working to make sure we can support our community's needs depending on what the numbers are. But we're okay at Hawaii Pacific Health.
I want to ask this question from Stephanie, just about schools, and it's a question that we get kind of a lot, which is, do you agree with the decision to move forward with in-person learning, especially considering kids under 12 can't get vaccinated yet? Do you think they should be in class? And do you think the multi-layered mitigation efforts are enough to keep keiki safe? What are you telling parents right now? Because I'm assuming that as school started, you were getting a lot of calls.
What I'm telling parents is to review the school's policies with regards to how they manage COVID infection. What are their policies on how they organize their classrooms in terms of maintaining social distancing among the children and activities? And then I coach parents to make sure that when their children are going to school, all the usual things, make sure they're wearing their masks, make sure they're being mindful about social distancing with their friends and classmates, make sure they're keeping their hands clean. And that's as good as you can get in the classroom setting. And then when the vaccine does become available for their age group, then I recommend that they get their children vaccinated.
What would you recommend to those parents who maybe get word that their child may have been exposed to COVID-19, say someone in their class or maybe someone in a friend's group? What should that standard protocol look like for those parents who may have had, whose children or a child and potentially family members may have been exposed?
If a child has been exposed in the classroom, then they would be asked to stay home and quarantine for 10 days and ideally maybe get tested about 5 days after the exposure just to determine whether they did turn positive from the exposure or not. And then monitor really closely for any symptom development. And if there are any symptoms that developed, certainly touch base with your child's pediatrician and get evaluated, see if they need any certain treatment or maybe other testing that might need to be done.
The thing with children, and I have a 2 and a 5-year-old, is that sniffles and coughing, it's just sort of a part of life. And as a parent, you get used to it. But now with COVID, every cough you think could be something. So as a parent, what do I look for? What are you telling people to look for when it comes to COVID in kids? Is there anything unique that would be specific to COVID? Because, little kids get viruses all the time.
Right, and those viruses could be your run-of-the-mill upper respiratory viruses, or it could be COVID. It's tough to tell. So, I would have a low threshold for testing. That way, you can ensure that if it is COVID, you know about it, and that would impact whether your child is going to school or interacting with friends or family members and whatnot. But if you know your child has sniffles and allergies, I would tell parents to look out for something that's a little different out of the norm. Like, are they feeling a little bit more run down? Is their appetite a little decreased? Are they are they having a fever, sore throat, or any other symptoms beyond what they normally have from the sniffles? Those would all be extra things that I would look for.
Lisa has another question. What is your advice on travel to the mainland for children under 12 years old? Again, we know that is an age demographic that does not have access to the vaccine just yet. But what would your advice be for those parents who maybe are planning some travel with their family?
My advice would be, if it is elective travel, meaning not the emergency or something required, to try and postpone it and hold off on it, because traveling, even if you're wearing a mask on an airplane, by nature, you can't necessarily socially distance, and going through airports are crowded. So I would say, if it is something that you could postpone, certainly think about it. If it's elective, maybe see if you can reschedule it.
There's a question here. We've heard a lot about monoclonal antibody treatments, and Cheryl wants to know, can children get monoclonal antibody treatment to avoid going to the hospital? What sort of treatments, if a child is presenting with COVID and they have a more serious case, what are the options for treatment?
Monoclonal antibody is authorized by the FDA for use in 12 years and older. So for under 12 years, monoclonal antibody is not available for children. It would be a matter of what we refer to as supportive care, managing fevers if there is a fever, making sure the child drinks enough fluids to stay hydrated, looking out for any severe respiratory symptoms that might require more support and maybe hospitalization for breathing support, those type of things. But unfortunately, monoclonal antibody is only authorized for 12 and above.
And just to stay on the monoclonal antibodies treatment overall, what have you been seeing? I mean, is that something that HPH it currently is also using in its way to treat COVID patients that are 12 and above? And what are some of the things that you folks are seeing through those treatment?
We've been administering monoclonal antibody on an outpatient basis since November last year when it got authorized, and it's really actually the only authorized treatment for outpatient COVID-19. And what the intent is to prevent progression of COVID-19 from mild to moderate illness to severe illness requiring hospitalization. So we see monoclonal antibody as an opportunity to treat COVID-19 on an outpatient basis to minimize the progression of illness that might require hospitalization. It might be a way for us to minimize the strain on hospital resources.
There's a question here from Joel. He says, if my grandkids already had Delta, are they safe? I don't know that we know what variant someone has contracted, but overall, generally speaking, does having had the virus, give you more natural immunities, and should you think that you have a layer of protection then?
Yeah, catching the virus is a natural way of getting immunity, and hopefully the viral infection isn't severe enough to make you really sick and that you recover well from it. It does afford you immunity. The CDC has been suggesting that the immunity lasts about 90 days or so, but nonetheless, it's hard to tell how good your immunity developed in fighting off the infection. So that's why the vaccine is still recommended for individuals who've recovered from a COVID-19 infection.
We know that there were a lot of questions also and concerns about those who are expecting those mothers to be, who are pregnant at the time right now and maybe are hesitant about getting the vaccine. What would your advice be to those mothers out there who are still contemplating whether or not to get the vaccine during this time?
My advice would be to go and get the vaccine. You're not just protecting yourself and family members and community, but you're also actually protecting your unborn child. Because when you get the vaccine, you're developing antibodies and protection within your body, and those antibodies cross over to the developing baby. So the baby is actually getting antibodies as well too. So when the babies are born, they actually have some degree of protection to COVID-19 if you got vaccinated during your pregnancy. So I would recommend, I'm sorry, Angie, yes, I would recommend pregnant women to get vaccinated.
And following that, Peter has a follow-up question. Are breastfed infants, do they receive any kind of protection or vaccine protection through breast milk if the mother is vaccinated? Yes,
they do. That's another benefit even after delivery, because those antibodies do come out in the mother's breast milk. And when the babies are feeding on the breast milk, they are getting the antibodies there as well too.
Do you know about how many pregnant women you folks currently have at Kapiolani? I know it's hard to have any specific numbers at this time, but are you seeing those types of patients entering the hospital right now that are requiring assistance because they have caught or are infected with COVID-19?
I don't have any specific numbers, Ryan, but I can tell you that we have been seeing pregnant women coming in that have not been vaccinated that are infected with COVID-19, and we've been managing them and managing the pregnancy as well too, which is why we've been really concerted in our efforts to try and get the message out that pregnant women should get vaccinated. The American College of Obstetrics and Gynecology has recommended that pregnant women get vaccinated. The American Society of Maternal Fetal Medicine has also come out and recommended vaccines for pregnant women. So it's the best thing that pregnant women could do to protect themselves and their unborn child.
One thing that state leaders and local leaders are monitoring, of course, is hospitalizations. And when we see the COVID counts, we've been told that within 2 to 10 days, we can assume that about 4% of those folks would end up in the hospital. Jamie has a question, and the question is really, does that differ for children? What percentage of children that contract COVID actually end up in the hospital? Is it lower than that general 4%?
In general, that's tough to tell because we do know that children tend to be infected less severely than adults. So, they require less hospitalization, but nonetheless, that doesn't mean we get complacent about our children or our pediatric population because they can get sick and they can end up in the hospital. So, I would just say that even though the general sense is that children might not be infected as severely, it doesn't mean that they can't get sick. So use protective measures to try as best we can to protect them against COVID until they're available to get the vaccine. Mm.
Last year we saw a significantly lower number when it comes to flu cases and those who are reporting flu here in the islands and really nationwide because of the fact that there was a lot of isolation. People are not wearing masks. But there is some concern about flu season heading into this current season when flu is often pops up in schools and especially with kids. What would your advice be for those parents who are making the decision whether or not to have their kids get the flu shot or can that be combined with those children who are eligible for the COVID vaccine as well? How does the flu vaccine tie into all of this?
I would recommend parents get flu vaccine for their children as well too. We know that flu and COVID symptoms can look the same. So, you might have flu, but the concern would be, do you have COVID, and vice versa. And if you can do anything to protect yourself from getting one or the other or both, then better off for you in terms of protection. That you can get the COVID vaccine and the flu vaccine at the same time. There does not have to be any time period or window between the vaccines. So if you got COVID vaccine, let's say on Monday, you'd still be able to get the flu vaccine on Tuesday or Wednesday. You can actually get them at the same time in different arms.
There's a question here, and I don't know if you have the specific numbers. Jas is saying, last week we had 60 kids in the hospital. How many of those kids were in the ICU? I don't know if you have the breakdown. And there's some other questions. How many Keiki do we have in the hospital right now? And also sort of the question of capacity. Does Kapiolani have enough pediatric beds to support all of these kids who are needing this advanced care?
Yeah, unfortunately, I don't have specific numbers for you, but I can tell you that we do have capacity at Kapiolani to care for our children. So if any children do have needs for COVID-19 treatment, we can take care of them at Kapiolani.
We know also one of the things that has happened because of this recent surge has been just some other medical treatments as well as procedures being put on hold because of just the overall capacity. Has that been an issue at Kapiolani with any other children? We know, of course, that is a hospital that treats cancer patients and those children who are receiving other terms and types of treatments. Has there been any impact to those patients during this time?
No, there hasn't been. There's been good access to medications. I would say the only medication we're keeping an eye on is monoclonal antibody, since it's a treatment for outpatient COVID-19, and it's being utilized much more nationally as well as here in Hawaii. So we're keeping an eye on our supplies and our distribution of that medication.
I want to ask about the vaccine for those who are over 12, but they're still kids. What are the reactions that you've seen, if any, in children who get the vaccine? And what are you telling parents as they wrestle with the decision whether or not to have their children vaccinated?
For those children 12 and up that have been getting the vaccine, it's pretty much been the same as adults, primarily pain in the injection site, maybe some muscle soreness, maybe a little bit of fatigue, sometimes headaches, stomach aches, but less frequently than the muscle aches and pains. And these symptoms tend to resolve within about 1 to 3 days after getting the vaccine. So it's about the same that we've seen in 12 and ups. We'll just have to see what the studies and the data show for 12 and under with regards to the side effects, because that's something that for sure the FDA is looking at with regards to offering an authorization for that age group.
We know that youth sports also plays a big role in the development of children. Do you think that right now this is a time when it's safe for kids to be participating in sporting activities and team sporting events?
I think it's the same kind of thing as classrooms with regards to sporting events. If the sporting events can be very mindful about social distancing, about mask wearing, about making sure that kids aren't sharing water bottles and things of that sort, where you can do it appropriately, then we can do it. I think it's also important to make sure that our kids can get out and do outdoors activities. We wouldn't want them getting cooped up and having cabin fever because they can't do anything. That could affect their health in a very different way. So looking for means of being able to do outdoor activities and sports in an appropriate fashion to keep them safe.
Back to that under 12 set, how soon do you expect the vaccine to be available for those between the ages of 5 and 12?
I think the latest word is hopefully by the end of the year, maybe as soon as by the end of October. The FDA has been very mindful about making sure that the data that they evaluate in the pediatric population, or 11 and under, is safe. They don't assume that children 11 and under are just little adults. They're very different individuals, and as such, they're looking at the data very, very differently than they looked at data with the adults. They want to make sure it's safe, and they're not going to assume that just because it was safe in adults, it's safe in children.
As a pediatrician yourself and someone that sees and cares for children and in different pediatric age groups, has there been any common question or something that you are often faced with as a physician, and when parents are coming in and their concerns about this? What are your conversations like right now with some of those parents, and what do you tell them when it comes to COVID-19?
I would say the questions that I've been asked are exactly the same questions that you and Yunji have asked today. These are the very questions and parents are concerned about and wondering about. And so these are the very conversations I have with my patients in my office.
Yeah, and to follow on that, I'm interested to know, just in lifestyle choices, we can only control so much. We can't control when we get the vaccine, or what happens when our kids go to school, other than asking the questions that you suggested. What are you telling parents about personal behavior and what is safe and what is not safe in terms of taking kids to a restaurant and engaging in social activities? We're approaching the season. The holidays will be here before you know it, and it'll be Halloween and trick-or-treating and all of those things. And we scaled back and we did everything on Zoom, and there were some downsides to that as well. So how are you telling families to sort of navigate this in this time as we wait for the vaccine to be available for those who are the youngest?
It all comes down to the same things that we've been sharing, kind of since the beginning of the pandemic, with regards to mask wearing, social distancing, keeping hands clean, especially before you touch your eyes, nose, and mouth, especially before you eat. Avoiding large crowds, those type of things. I think those type of mitigation efforts that have been put in place are things that we can be very mindful in terms of judging what activities are safe for our children and our families.
And overall, we know also that there has been a lot of assistance that's been brought in from the medical community outside to support the Hawaii nurses and the Hawaii frontline workers from those coming from the mainland. Is that something that you're also seeing with regards to assistance that's being needed at Kapiolani with children, or has their assistance and the help that's coming in from the mainland really been regulated to, say, Straub and some of the other facilities that support more adults?
No, the help that's been coming in has been going all over, and it's been in support of our staff and helping us do other initiatives, such as doing monoclonal antibodies. There are FEMA teams that are coming out solely with the deployment to help the state with administration of monoclonal antibodies. So, it's been a great support, and it's been throughout Hawaii Pacific Health.
Can you tell us, we're running out of time here, but what is your advice to families right now, when it comes to navigating this? I know you said that more testing as opposed to less, but let's say our kids come home and they do have a little sniffle and we just don't know. And also kids can be asymptomatic. What are you telling parents when it comes to how much testing to do? And because that's also, I mean, I've had my kids COVID tested and it's not fun.
No.
And so there's a downside to that as well. But of course, the assurance of knowing is very important.
I think the best advice would be to touch base with your child's pediatrician. If you have any worries or concerns about any symptoms, certainly connect with your pediatrician and have them help guide you in terms of what type of evaluations or tests, if any, need to be done.
During this time, there has been so much discussion with COVID-19 and information that is out there and being presented online, as well as just those who feel like the vaccine is not for them and a decision that they have made that they do not want to get vaccinated. As a medical professional yourself, what would you say, just in terms of your experience and the schooling and the research that you've done on your side about the vaccine? And what would you say to those individuals who are still considering the vaccine, but maybe reading something online that is deterring them from getting it?
Yeah, I do understand an individual's right to choose on whether they want to get vaccinated or not. But from the data and the studies and the experience that I've seen with regards to the vaccines are safe. And they are very good at doing what they're designed to do in terms of protecting you from getting infection. But should you get a breakthrough infection, it's good at protecting you from getting a severe infection that might require hospitalization. So vaccines are good. It's a way of not just protecting yourself, but your family and friends around you and the community at large. So I would recommend anybody who hasn't got their vaccine yet to think about getting it. It's one of the largest ways for us to get out of this pandemic.
Okay. Great words of wisdom this morning from Dr. Douglas Kwock from Hawaii Pacific Health. Thank you so much for being here this morning.
Thank you for having me.
Thank you. Aloha.
Well, great to hear from him. Thank you, all of you who are, submitting those questions. And, he said that we covered a lot of the same ground that he's having with his patients and with their parents right now as they try to navigate this time. There is so much uncertainty. When it comes to kids and COVID, he says, for the most part, they do recover faster than adults. But that said, there have been kids here in Hawaii that have needed to be hospitalized and that have needed to be intubated and in the ICU. So this is still a very serious illness, even for children. And he's recommending all of the same mitigation measures, he says, that we've been talking about since the start: masking, hand washing, social distancing, and if it's an option for you, if you're over the age of 12, to get a vaccine.
And also noting that it is not a safe time to travel. That was a question that also came in from a parent who was wondering if this is the time where, they could take their child who's 12 and under to go to the mainland and go on a trip. He's saying that if it is not essential, that this probably is not the best time to be traveling with your children. And also noting that with the flu season, that he is recommending that children still get their flu vaccines as well, and that you can get the flu as well as the COVID-19 vaccine. He's saying at the same time, there isn't any damaging side effects from getting them together. So he's continuing to push that as well.
Yeah, very important to get the vaccine because COVID symptoms and flu symptoms can look very similar. So at least if you can sort of rule one out and make sure that you're not getting sick and then thinking that you might have COVID, because that brings on all of its own stresses. Of course, important to have connections to your own pediatrician. And he did give some encouragement, saying that they do have enough facilities right now at Kapiolani to take care of the pediatric cases that they are seeing. But it is important, of course, these hospital resources are limited. So it is important to do everything you can in terms of mitigation to prevent any of these cases in the first place. On Friday, Ryan, we're switching gears. The pandemic basically infiltrates any conversation we have, but we are going to be talking to someone who would like to take the helm at the Hawaii State Capitol.
That's right. Recently announced a candidate for governor, Vicky Cayetano, the former First Lady, will be joining us here on Friday as she begins her campaign for that quest to become Hawaii's next governor. Of course, we want to talk to her about her thoughts of what's happening here with COVID-19, what she would do differently, and how she thinks public officials have done during this time. We know that her opponents will be the Lieutenant Governor, Josh Green, as well as former Mayor Kirk Caldwell. And so wanted to get and interested to talk to her about her opinions on how these leaders have done during this time and what she would do differently, as well as a lot of other state issues that this person coming into this role will have to face.
Yeah, and it's very interesting because she is a very successful businesswoman. She, of course, has had a front view of politics as Hawaii's first lady, but never a candidate herself. So it'll be interesting to talk to her about why she decided that now was the time for her to step into this leadership role and why she thinks that she would be best at the helm. So we look forward to our conversation with Vicky Cayetano. That's 10:30 right here on Friday. Until then, stay safe. Have a great rest of the week. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.